Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine. In just around 15 minutes, we will bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are joined by Dr. Nathalie McKenzie. Dr. McKenzie is a board-certified gynecologic oncologist, lifestyle medicine certified physician, and Advent Health's Gynecologic Oncology Fellowship Program Director. Specializing in robotic-assisted surgeries and complex care procedures, she's dedicated to advancing cancer treatment and whole person care. A cancer survivor herself, Dr. McKenzie co-founded the HEAL program at Advent Health, promoting wellness through healthy lifestyle education. Fluent in multiple languages and deeply involved in global health initiatives, she mentors physicians and researchers worldwide, helping to improve cancer care for women in underserved communities. With a passion for mentorship and patient advocacy, Dr. McKenzie is committed to extending and enhancing the quality of life for those facing gynecologic cancers. Welcome, Dr. McKenzie. How are you doing today?
I'm very well, thank you. Excited to be here and to do this 15-minute podcast with you.
Wonderful. We're so great to have you here today. So I would love to start by hearing about your journey into lifestyle medicine. How did you learn about it, and what inspired you to pursue board certification in lifestyle medicine?
Certainly, my journey started before, or maybe around the same time that the lifestyle medicine board was thinking about making it a thing, right? But my journey with cancer started in 2004. And at that time, immediately post my cancer experience, I spent some time in the south of France with a distant cousin, an elderly couple who taught me about really community, about whole food, plant-based eating. It was their way of life. Wow. She also, in her 80s, she participated in yoga regularly. And I thought to myself, really, this is how I should spend the rest of my life. And of course, like most of us humans, we don't always stick to the program, right? But to have had this exposure immediately after completing chemotherapy was instrumental in embarking on this awareness for myself. So as I became a mid-career gynecologic oncologist, I wanted to help my patients by doing more than just surgery, chemotherapy, immunotherapy. And I thought back to that experience and how I had an opportunity and a platform. So I started to think through and the brainchild of what would later become the HEAL program. And then I identified that the American lifestyle medicine was the structure, the organization, and the message that I wanted to be able to convey to my patients. And that's how it all started.
Wonderful. Well, it's powerful. And thank you for sharing your personal journey. It's always very inspiring when we hear about real stories and how people overcome these challenges, and then they become the light to inspire so many others. So thank you for creating that HEAL program. So how can lifestyle medicine support patients with gynecologic cancer, and what are the key benefits of bringing it into oncology care?
Well, when you think about it, cancer treatment and the cancer itself have profound effects on persons and people. So from fatigue to muscle atrophy and deconditioning and malnourishment, malnutrition. Some patients suffer from physical inactivity and sedentary lives, from central adiposity, all of which have downstream molecular effects on wellness and overall longevity. So when you think about the multitude and the multidimensional aspects that cancer and cancer treatments can have on people, we can clearly see how wellness, nutrition, physical activity, increasing muscle mass can begin to reverse some of the damage, if you will, of the negative effects of the cancer treatment. I'll give you an example. Cancer-related fatigue, for example, which is prevalent across a multitude of cancer types and cancer treatments, is mitigated by increasing muscle mass, right? So when we're deconditioned, we experience that fatigue a little bit more. And when we begin to increase muscle mass, for example, one of the pillars of lifestyle medicine is physical activity. When we begin to increase muscle mass, we can mitigate some of that cancer treatment-related fatigue. And that's just one of many examples as to how the 6 pillars of lifestyle medicine play a critical role in not just preventing cancer, of course, but to help the cancer patient.
Yes, yes. What are the best nutrition tips for cancer survivors, and how can a healthy diet help prevention and recovery?
Certainly. So, of course, all foods, plants have over 100 bioactive compounds and phytonutrients within, and the nice rainbow of all of those foods each have complementary vitamins, antioxidants, and coenzymes that come together and provide optimal health. And with optimal health, I mean that within our bodies, within our cells, there are chemical reactions occurring every minute, every second that are dysfunctional when we don't have the right ingredients within our body, and are optimal when we make sure that we have those ingredients within. And so if you think through our weeks or days, when we are able to optimize those types of foods, we optimize function. But conversely, we can also think about nutrient poor foods, right? Foods that are lacking in any nutrients. And this is the concept of nutrient density. When we think about foods that are lacking in those nutrients, we're consuming empty calories, right? And this leads to that negative inflammatory cascade, which is so dangerous in cancer, both from a cancer risk and a cancer recurrence risk. And there are studies that show that patients who don't have an optimal nutrient diet don't respond to cancer treatment as well as those who do.
Absolutely. And what are some practical ways that healthcare providers can implement some of these nutritional guidelines into patient care?
Well, I'm really excited that the American College of Lifestyle Medicine has a one-page flyer that says you've been diagnosed with cancer. Here are some healthy tips. I love that. I printed it out and I try and hand it out to as many of my cancer patients as possible, because it talks about the 6 pillars in very easy ways. But, you know, on a practical level, when I see my patients and I'm doing a quick physical exam and I'm asking them how they're doing, sometimes I keep it simple. I say, are you eating enough veggies and drinking enough water? Please think about your veggies. Make sure you eat as many colors in the rainbow as possible. Drink enough water, and manage your manage your stress and get a good night's sleep. And so I keep it simple, and
Mhm.
that's the bottom line takeaway for them. They're eating their rainbows, they're trying to eat lots of veggies, drinking enough water. So those are
Mhm.
the practical tips. And then, of course, in the Heal program, we take a really deep dive of at least 20 hours worth of education for these
Wow,
cancer patients.
very good. Yes, so thank you for highlighting some of those ACLM resources as well. Can you share us some examples of how nutrition interventions have positively impacted cancer survivors?
Absolutely. So there are numerous studies that show through randomized clinical trials and prospective cohorts, even retrospective data to show that along multiple different types of cancers, especially the ones that tend to be related to obesity, but not just, and that patients have overall better quality of life. They have a reduction in symptoms during cancer treatment. They tend to report better medical overall medical symptom questionnaire, overall outcomes and quality of life. And we are also beginning to see now better response to cancer treatment, and that's the exciting part.
Yes. So, how can oncologists and other healthcare professionals better integrate lifestyle medicine into cancer care?
I think that if we, I've thought about this a lot and I've thought about many strategies. For example, the ACLM has a short form, a short
Hmm.
intake form. It doesn't take a long time, but these are our vital signs, our six pillar vital signs. So what if we ask about, do you have food insecurity? Are you able to access whole foods,
Hmm.
and have an intake a whole food plant-based diet? Um, are you sleeping? Are you managing your stress? Those sorts of things. It doesn't take a lot of time to ask. The physician can ask, but the medical assistants can ask, the other members of the practice can ask those questions, and then to provide the resources naturally. And it is my hope that every cancer center, every cancer practice will ultimately have either a provider, access to a course, or additional resources for all of their patients. But at the very least, to begin to broach the conversation, I think is low-hanging fruit and what we could all probably do for our patients.
Yeah. And what do you think are the biggest barriers to implementing lifestyle medicine and oncology? And how can we address them?
Time. And,
Yeah.
I think that's why I created the Heal program, because I realized that if I have a certain number of patients to see in a day and in my practice,
Hmm.
the time it takes to impart the importance of those pillars, to impart the importance of proper nutrition, it takes time, and I only have so much time in a busy day.
Sure.
And so I found that for me, that to buy that time back, just 90 minutes from the practice, whereby I have shared medical visits and I'm
Hmm.
able to impact the lives of many patients in a 90-minute session, that's what worked for me. But I think time is also the obstacle. Before Heal, time was my obstacle. And we have to find a more efficient way to ask those questions and to impart the importance of nutrition and the other pillars, and to provide resources. Perhaps we don't have to do it ourselves. I want to do it myself, but we don't all have to do it ourselves. Maybe we find a way to help our patients access the right resources from credible sources.
Yeah, and including maybe referring to a lifestyle medicine certified clinician could also
Exactly.
be a option. Absolutely. As a faculty member for our upcoming Food as Medicine course on cancer, could you share some insights about the course? And also, what can participants expect to learn? And how will it help shape their approach to cancer care?
I'm so excited about this course. You know, it's really one of many food as medicine courses, but I really think this is going to be a huge impact, especially for those who are touched by cancer and who, even in their primary care practices, have cancer patients. Cancer patients, by and large, want to know that recommendations are applicable to them because they are definitely a special population. And to know that there's a food as medicine course specifically for cancer will also, I think, allow all of our ACLM certified physicians and others who are interested in this course to feel confidence that we've done the work of vetting the data. We've done the work of going through the credible sources. And we don't just provide the guidelines, which everybody wants to know, how to implement the guidelines, which we go into as well. But also where we got the data from, so you can feel confident when conveying that information to your patients. And I want to remind you that we do provide practical tips. And I think that's what everybody wants to know. Of course, we want to know if the source is credible. And of course, we want to know the details about the guidelines. But I think what's important for all of us is that practical tips are provided throughout this course.
Wow, this is so inspiring. I really enjoyed our conversation, but unfortunately, we are out of time. Thank you, Dr. McKenzie, for sharing your time and expertise today. Thank you to all of you for tuning in to this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.